Hello friends, today we'll see what are the IC10Z codes should be used as primary and secondary diagnosis. Since there are a lot of IC10 codes, it's not necessary that every code can be used as primary diagnosis. There are some diagnoses which should be used only primary diagnosis or some manifest. So we'll see some of the Z codes especially which we can use as primary and secondary only. So first we'll see the follow-up codes. For follow-up codes, we have two codes Z08 and Z09. So for Z08, we are using for follow-up examination after completing the treatment of the malignant neoplasm. So here we have to code first the follow-up code followed by there are two follow-up codes. One is Z08 and one is Z08 is used for follow-up examination after complete treatment of malignant neoplasm, and other than neoplasm we have to use Z09. So these are actually primary codes, should be used as first listed diagnosis. See, the guideline says if the patient is seen for follow-up after completed treatment of this condition and the condition no longer exists, a follow-up code should be sequenced first, followed by the appropriate personal history and genetic susceptibility codes. So if a follow-up condition, a condition does not exist, the condition has been resolved or has been treated and or cured, then it will go into a history condition. But before coding the history condition, we have to code the follow-up code. So based on if it is a neoplasm, malignant neoplasm which is treated and cured and no longer exists, you can use Z08 as primary diagnosis followed by the history of that malignant neoplasm. Other than malignant neoplasm, any condition is there like some any disease or that has been cured from any other body, so you can use Z09 as primary diagnosis followed by the history of that particular disease code. So here the genetic susceptibility codes also needs a follow-up code first followed by the genetic susceptibility codes. So next we'll see what Z codes can be used as secondary diagnosis. So here we are taking one example like Z15.0. Here as per you can see it says first you have to code the malignant neoplasm, then you can use the Z15.0 code. Example here, code from category Z15 should not be used as principal or first listed diagnosis. So as per coding guidelines, Z15 should not be coded as principal or first listed diagnosis code. If the patient has a condition to which he is susceptible and the condition is the reason for encounter, the code for the condition should be sequenced. So the first condition should be coded and then the genetic susceptibility code should be coded as secondary. As you can see here, it is saying code first if applicable any current malignant neoplasm. So first malignant neoplasm you have to code, then you have to use the Z15 series code as secondary diagnosis. Then another is when status Z code should not be used with other diagnosis. Actually this is now this you can see in exclude one note, but in some codes you won't get exclude one note to guide you whether these codes can be coded together or not. This is one example of that. So a status code should not be used with diagnosis code from one of the body system chapter if the diagnosis code include the information provided by the status code. So here you see one example is there. Diagnosis code is T86.2 and status code is Z94.1. So diagnosis code says complication of heart transplant. So it says complication of heart transplant means patient is having a heart transplant already. So there is no need to give another code to mention that Z94.1 it is a heart transplant status. So in such situation you have to code only one code. Either you code Z94.1 or either you code Z10T86.2, because coding both is not necessary. Unnecessary you are giving a more same information you are giving with another code which is not needed. So here you can code only one code T86.2 or Z94.1 because one code is enough to give the information of heart transplant. Incidental codes anyway it should be coded as secondary code. So here you can see Z33.1 pregnancy state incidental. This is always a secondary code. It should be coded as secondary only, because incidental conditions are never coded as primary condition, because they are not the focus of the examination and they are not related to any chief complaint or reason of visit. So here one example I have given, that 33.1 as you have to code it as secondary only whenever you find any incidental code. BMI coding also requires initial code like obesity. So and then to give more specific information about that obese person, we have to give BMI, which gives a specific information about his overweight or underweight or something. Z68 series is there, which will give more information about that BMI coding. Thank you to watch this video. If you like the video, do like it and do share it, and if you like the videos, do share, subscribe to my channel so that I can share more videos related to medical coding in future. Thank you again.